All right. So, hello, good evening, and welcome. I'm Katera Kapoor, and I have the privilege of being the Senior Director of Health Promotion, Wellness, and the Spark Your Health Talk series here at the 92nd Street Y. Thank you all for being with us this evening. We have tonight, we're joined by Dr. Heather Sandison, a leading expert in Alzheimer's dementia care and author of Reversing Alzheimer's, to discuss the newest approaches to improving cognition and protecting brain health. Our format this evening will be a moderated discussion followed by 15 minutes of Q&A. Please feel free to be submitting your questions throughout the duration of the event, and we'll get to as many of them as we possibly can at the end. We hope that you will join us for upcoming Spark Your Health talks, such as Cultivating Healthy Dynamics in Relationships with Dr. Alexandra Solomon and Terry Cole, coming up on September 30th, so next Monday at 7 p.m., amongst many others. I would also like to thank our Spark Your Health Talk series sponsor, Mount Sinai Health System, for their generous support. I am now pleased to introduce our speaker this evening. Dr. Heather Sandison is a renowned naturopathic doctor specializing in neurocognitive medicine. She is the founder of Solsere Health Clinic, San Diego's premier brain optimization clinic, and Marama, the first residential memory care facility to have the goal of returning cognitively declined residents to independent living. She has dedicated her career to supporting those suffering with dementia, and she is excited to shatter common misconceptions about Alzheimer's and share what she has learned about keeping your brain sharp at any age, something I think we all can agree we're excited to learn more about tonight. So thank you so much for being with us, Dr. Sandison. We really appreciate it.
Privileged to be here. Thanks for having me, Katera.
So we are going to dive right in because we have a lot to get through this evening. So let's start off with, you say in the book, you say that approaching brain health from multiple angles is just common sense, but not common practice. Can you elaborate on this?
Yeah, the conventional model of medicine, right, is this reductionistic sort of idea that if we put a diagnosis on it, we can come up with a pill or a surgery or something that can solve the problem with one type of intervention for that particular diagnosis. And yet, what we see with Alzheimer's and other dementias is that people can arrive at age-related memory loss through many different pathways, if you will. So one person might have traumatic brain injuries. Another person might have diabetes and toxic amounts of blood sugar. Another person might have genetic predisposition. Another person might have toxic exposures. And somebody else might have all of those. They're not mutually exclusive. And so you can have two different patients with similar symptoms who have very different reasons for why they've arrived at that diagnosis. And so when we put on our thinking caps right around this, and we kind of let go of some preconceived ideas about how we should practice medicine, if we just think about complex system science, I think we can all agree that the brain is a complex system. That means there's multiple inputs and there's multiple outputs and there's multiple things going on throughout the day. There's a homeodynamic balance and a rhythm. In terms of, cortisol is something that we hope is up during the day or in the morning to help get us out of bed and get us that momentum for the day. And then melatonin rises later at night to help us get restful sleep. These are accepted things, right? So there's this dynamic balance that shifts throughout the day. And I have houseplants behind me, right? If we were to have a houseplant that was struggling, we wouldn't look at it and say, oh, there's misfolded proteins. It must need a pill to fix itself. We would think about, what are the inputs? What are the outputs? Is it getting enough light? Is it getting enough water? Does it have enough nutrients? And there's no reason we should think about the brain any differently. And so even though it's a little bit cumbersome, it can feel a bit overwhelming. The invitation here is to take this common sense concept that we need a complex approach to a complex problem, right? A complex system requires that we systematically think through, what are the causal level things that might go awry, that might be dysregulated, that might be out of balance, that would then trigger a neurodegenerative process that might lead to dementia or Alzheimer's.
And I thank you for that. I think that's such a great way to start this conversation because you're also saying the formula is not going to be the same for everyone. So I think everyone should just keep that in mind as we're going through these questions and these topics, that it's probably not going to be the same recipe from individual to individual.
Exactly. It's a precision-based approach. And that can feel, it's not a one size fits all. And that's part of what makes it effective, but also a little bit squirrely, a little bit like, why can't we just pin this down to one thing? It just doesn't work that way.
Yeah, we're just too special of individuals. We need that individualized approach. So I love how you discuss the analogy of a brain, our brains being like a country. So can you tell us a little bit more about this analogy to help us understand and maybe give us some different perspective on how to look at our own brain?
Dr. Bredesen, my mentor, is the one who originally turned me on to this analogy, and I think it's so compelling. So he says, if you think of your brain like a country, my brainistan, if your brain is at war, if it is defending from invaders, from pathogens, from infections, if it has to defend or attack toxicity, right? If it's got to use all these resources, right? Think of a country at war. It's using a ton. Unfortunately, there's a bunch of examples right now. They're using a ton of resources, money. In the case of the brain, it's ATP. It's the resource that the currency that our brain cells run on is called ATP, adenosine triphosphate, and we can make that through different fuel sources. But if we're using all of it to attack and defend against foreign invaders like pathogens or against toxicity, then we've spent a lot of resource. And also, an intelligent, complex system isn't busy building roads and schools, right? You're not putting down infrastructure if you're a country at war. You're not building those new connections, the synapses, the connections between neurons, if all of your resource is going into defending and attacking. And so the invitation here is to identify, again, this precision-based individualized approach, identify, are there toxins that are present? Things like mold toxins, heavy metals, also chemical toxicity. If those things are present, let's get rid of them. Let's get up over the hump of the attacking and defending. If things like P. gingivalis, the bacteria associated with gingivitis, if Lyme spirochetes or other Lyme and the co-infections are present, if there's been a COVID infection, if there is herpes that pops up, shingles, if there are these herpes viruses, human herpes simplex viruses that are popping up, they are something that the brain will initiate an inflammatory response against. And if we can support the body in getting up over that hump, we can actually create more resources because we no longer need to spend them in that regard. We can now reorient towards regeneration and health and the creation of new connections between brain cells.
And some of those diseases that you mentioned, such as Lyme disease, even COVID, herpes complex, those are considered risk factors. Is
They
that?
are. Yeah, they are.
And so you're saying if we address the symptoms that come along with those diseases, then we can possibly improve our cognitive health. Is that right?
That's right. So we want to think about the 6 different components of brain health, and infections are not the only one, right? So toxins, we talked about toxins and infections, and those are 2 of them that we might be defending and attacking, right? We want to free up that resource, but we also want to think through nutrients. Do we have enough or too much? With sugar, it's very easy. Diabetes, you'll hear sometimes Alzheimer's called type 3 diabetes. It is a path that people take towards memory loss as they age, is having too much blood sugar or insulin resistance. We can't turn that glucose into fuel in the brain. And importantly, the brain only takes up 2% of body weight, but uses 20% of energy expenditure every day. So we need resource, we need effective resource. And sugar doesn't always do the trick, or glucose, carbohydrates, you could use those interchangeably here. So toxins, nutrients, infections we talked about, but stressors, structural issues, and then also signaling are all components of brain health that we need in balance. We need the right amounts at the right time in the right place. And so, yes, infections are one of these causal level risk factors that can be mitigated, but it's certainly not the only one.
Got it. Okay, so let's dive into a little bit of the Marama experience. I think we'd all like to learn a little bit more about what that approach looks like.
Yeah, so what we found working with patients, I've had the privilege over the past half a decade working with patients and seeing them get better. Now, there are also, this isn't a guarantee, and what we saw most often was that the people who weren't getting the benefit of Dr. Bredesen's approach, they weren't able to make the changes themselves. So what we're asking, again, this is common sense, right? A better diet, a healthy brain, healthy diet, exercise, social engagement. It's hard. I mean, you and I, it's hard enough for us to make changes in our own lifestyle when we have full cognitive capacity and we're younger, let alone when you're in your 70s and 80s and stuck in your ways, and dealing with cognitive decline. It's really challenging to cook differently, shop differently, live life in a different way. And so what we saw is that the people who didn't have enough support or resource to do that, they weren't getting the benefits. And I had people asking me, hey, I love this idea for my dad, but I can't quit my job and give up parenting my kids and running my household. I've got to do those things first. Where can I send my loved one? And so out of that question, we heard it enough that I thought, well, why not? Let's just create an immersive experience where we can do all of the hard work for people. We can do the cooking. And so many people think of memory care as a place, I think most of us, I certainly never want to have to need memory care. My mom is like, she's the first one to be like, just take me out and shoot me. Do not send me to a place like that. And so this was part of my inquiry around creating Marama is what if we created a place where people wanted to be, where they might come earlier with the hope of memory recovery, rather than just resigning themselves to memory care and this long downward slope towards demise. And so the goal is to have people come and recover their memory through these lifestyle approaches, through a organic ketogenic diet, through lots of social engagement, lots of activity engagement, vigorous exercise, and a non-toxic environment, and surrounded by people who are engaging them, caregivers who are engaging them with the expectation that they improve. And what we see is that we get, for the most part, when people move in, they improve.
I love that what you said about the expectation of improving, because I feel like people do tend to rise to the challenge. And so if you walk in and they, the doctors, the physicians working with you expect you to improve, that probably does a lot for one's mindset. So I want to jump for a second, actually, because you said that. So how can individuals, and we'll get a lot deeper into the tips that you have, but how can individuals that are interested in starting on a new journey, how can they kind of set the tone for their mind to be in a place where they're ready to change? I'd imagine there might be some preparation before going through something like Marama, or for anybody who's listening in who's about to make a change.
Yeah, that's such a great point. So Becca Levy, I know that there's a lot of literary interested readers here. Becca Levy wrote a book called Breaking the Age Code, and she's actually the one who established, she's a researcher, PhD researcher, and she established that people with a mindset that associates basically a positive association with aging, who imagine that life is just getting better and better. I think of channeling my inner Betty White, like her life just got better and funnier and more awesome the older she got, right? If we can imagine that for ourselves, we can live 7.5 years longer on average. So optimists live longer. And you can imagine, so say you fall and break your hip or you twist your ankle and you need physical therapy. When you're in your 50s, you're treated very differently than if you're in your 90s, because the physical therapist is expecting a different level of engagement, a different level of basically healing. And so sometimes you're getting set up to decline, and sometimes you're getting set up to really heal. And when we change our expectations for ourselves, we get different outcomes. And so that mindset shift, I think, is the first step. This expectation that there's something worth living for, that there's something to look forward to. That, I think, is the number one place to start. And then the next place is information, right? Like, what does this really look like? What are we going to do? And I want everyone to, as we go through the things to do, it can often feel like a long list. And I want you to think of it like a buffet. So like if you come to the fish at the buffet table and you don't want fish, don't grab the fish. There is so much on this buffet table that you can pick and choose the things that fit for you. And also potentially think, when we coach people, we talk about two different places to start when you're ready to make some change. One is pick something really easy. So if you hear something as we go through this where you're like, oh, I would just have to add 1 day a week, or I already know where that is, I just have to pull the trigger. Do it. That is a great place to get that dopamine hit and the momentum that you're succeeding. So for example, I had a patient who, she was going to church every Sunday, and she went to church with other people in her neighborhood, but she was feeling more and more isolated since losing her driver's license because she has dementia. But her neighbor was going to a Bible study and then also hosted a Bible study once a week. And so she could get in the car with her neighbor and go to the Bible study, or just walk next door a couple other days a week and stay more socially engaged. So now she was going to church, Bible study on Tuesday, and Bible study on Thursday. So all of a sudden, she went from 1 day a week of having social engagement with her peers to 3 times a week. And this was relatively easy for her to do, right? It didn't require a lot of money. It didn't require a lot of coordination. And so that that was a great place for her to start. And then it like there was momentum because then other people were exercising in that group and they could pick her up and take her to a pickleball lesson or whatever it was. And so that's one place to start. The other place to start is if you hear something and it's like, oh, I've known I've needed to change my diet, or I've known I needed to start an exercise routine for a long time. And I know that that's the biggest thing weighing on my health. Maybe today is day one. Maybe today is the day to make that really big change because you know it's where you're going to get the most benefit. And so as we talk through these things, be listening for both of those. And there's no right or wrong, but these are just invitations for where to get started so that you can start feeling the change and feeling the benefits and momentum, hopefully, and start layering them on top of each other.
Yes, thank you for that. And I feel like one of the things you're saying is being intentional about one's approach. I love that you brought up pickleball. We do a lot of pickleball at the 92nd Street Y, but looking at that as something that, yes, it's fun, it's socially engaging, but it's also doing a lot of work behind the scenes to support your brain health. So I love that. Okay, so let's start digging a little bit deeper. You mentioned that there's 8 tools that you recommend in your Alzheimer's toolkit. So we'll get a little bit deeper into a few of those. I wish we had even more time to go through all of them, but if you could just lie those out for us, and then we can pick and choose a few to get deeper into.
Sure. Yeah. So we have the diet and exercise are always first, but diet, exercise, stress management, partnering with providers, getting care, especially care for the caregiver, is really important. And then activities are important. And I feel like I have to cheat here because I'm like, 8, did we get them all? Really setting up a doable plan is such a big piece. Getting organized with daily routines because our health is really determined by those small decisions that we make each day. It's what we put in our mouths. It's what time we go to bed. It's who we engage with. It's how much movement we get. The routine is what determines the trajectory of our health. So that is such a great place to start. It's not the exception, it's the rule that really makes the imprint on our genetics and how things manifest. So daily routines, movement, diet, activities, environment is so crucial. Caring for the caregiver, partnering with your provider, and then using the technology and the tools that are available is another big piece.
Okay, thank you. I hope everyone got those. Maybe we'll put those in the show notes at the end. So because you mentioned diet and exercise at the top, maybe we can dive into that. So what is the latest research saying on the best diet for keeping our brain healthy? Because I feel like a lot of us think it's constantly changing, right? There's always something in the news about flow to this diet, flow to this diet. So what are you hearing in your research world?
Yeah, so actually, just this past weekend, there was a new research that suggested the MIND diet, MIND, was particularly effective in African American women. And this is contrary to some research that came out earlier this year that said that the MIND diet actually didn't help to prevent dementia and Alzheimer's. So there is a lot of conflicting evidence out there. It can be very overwhelming. And what I would suggest, I think like taking all the complexity out of it, to make it super simple, what you want are 2 things: to eliminate processed food as much as possible. So what is processed food? How do we define that? If you could make it in your kitchen, then if the ingredients are in your pantry or in your refrigerator, then it's probably okay. Now, people will say, well, what about sugar and honey and all of these things that, because I'm kind of anti-sugar. I really think it's important to get into ketosis. An organic ketogenic diet, I think, is the best diet for healing the mind and potentially reversing dementia. Now, if you're not ready to go there, then eliminating processed foods is the highest level, I think, nutritional advice that you can give. So anything that doesn't come in a package, basically, if you ask the question, can this spoil? Will this go bad? And if the answer is yes, then it's probably okay. It's the stuff that comes in plastic packages and never rots. That's a little bit scary. That's not food typically. So another way to think about it, can you pronounce the things in the nutrition label? Guar gum and maltodextrin, all these things we don't know what they are. When they're showing up on that list of ingredients, that is highly processed food, which is designed to be profitable and palatable, not nourishing. And so we want to get rid of as much of that as possible. And then the second step is Ketosis, basically getting the metabolic flexibility of going back and forth between burning fat for fuel and burning sugar for fuel. And I alluded to why this was beneficial. Part of it is because as we age, regardless of our diabetes status, so even if we do not have diabetes, as we age, we become less sensitive to glucose. So it's harder for us, and insulin as well. So basically, insulin is, I think of it like the key that unlocks the door so that glucose can go into the cell and become ATP, that currency that our brain runs on, our bodies run on, our cells run on. And if we can't, if that key is sticky in the lock, it doesn't open the door. And then once it gets in there, if the sugar gets into the cell and it's not turned into ATP very well, then we don't have that resource that the brain needs to fight the war, to regenerate. And so what we want to do, and the human body, I mean, it's just this divine design. It's so incredible to me. It's wild because we're like hybrid engines. We can switch back and forth between using glucose for fuel and using ketones or fat for fuel. And so when we create the right environment, we basically extract the carbohydrates, we reduce our carbohydrates pretty significantly, it kicks us into ketosis. And in ketosis, there's an experience of mental clarity, exactly what we're looking for. And also there seems to be a regenerative kind of reset that gets hit. It's a less oxidative diet. It is a less inflammatory diet. So you get anti-inflammatory, antioxidant benefits, plus detoxifying benefits. And as we talked about, toxins can be harmful to the brain. So getting those benefits in ketosis can be very, very helpful for cognitive function. Now, I would never suggest that anyone stay in ketosis forever. And there's a bunch of data on this as well. So you want to go into ketosis. I recommend for anyone struggling with cognitive impairment to be in ketosis for 3 to 6 months. And then there's another diet that has relatively good data for brain support, and that's a plant-based diet or a vegan diet. And so Dr. Dean Ornish, he published in June of 2024, just recently, he did a randomized controlled trial that had several lifestyle interventions, including a support group, some supplements, exercise program, and a vegan diet. And he showed that just in 5 months, the intervention group compared to the control group improved their cognitive function, even though they had mild cognitive impairment or early Alzheimer's disease. So this is the first randomized controlled trial showing that a lifestyle intervention can improve cognitive function in cognitively declined participants. Now, we did a clinical trial in my office. We did a 6-month intervention on participants with mild cognitive impairment. And we used an organic ketogenic diet, and 74% of them improved as well. So there is research showing that these comprehensive lifestyle interventions with several different diets can be very beneficial. So the good news about that, although I strongly believe that the organic ketogenic diet is the one, the good news is that if you're not ready to get into ketosis, there are other diets that are beneficial for the brain.
Wow, that sounds so promising.
It's exciting. It's an exciting time.
Oh, good. Well, thank you for that. I hope I will take this opportunity to remind our audience, please submit questions into the chat. I feel like there's a lot of different directions we could go, and we certainly would love to hear your input on questions in probably about 20 minutes. So we covered a little bit of nutrition. Actually, that felt like a really great deal of information. So thank you for that. So let's jump into exercise and sleep. So you mention in the book that walking is great. We all know the 10,000 steps rule, but just getting in a walk, it can be fantastic for the mind. But you also say that it's not enough. Can you elaborate on that a little more?
Yeah, when we think about exercise for the brain, right, we're asking for a miracle here. If we're asking to reverse Alzheimer's, we've got to do more than just walk. Now, walking does, if you get about 10,000 steps a day, the research shows that that prevents you from getting dementia by about half, which is huge. So if nothing else, walk. However, if you have a genetic predisposition towards Alzheimer's, or if you're suffering with cognitive decline, I recommend doing more than just that. So the general recommendation is 200 minutes a week of moderate to vigorous exercise. And you'll see anywhere from 150 to 300 minutes a week. I think of 200 minutes a week as it's like 4 1-hour classes with maybe a little bit of warm up and cool down. And what you want to do is get your heart rate up. So I'm going to talk about 3 different types of exercise. One is aerobic exercise. Most of us know what that means. Getting your heart rate up to that moderate to vigorous exercise, which is usually like 60 to 80% of max heart rate, which we can go through that calculation if someone wants to. And then second is strength training. And when you do HIIT training, like the high intensity interval training, that also often will combine those two. So I'm an efficiency queen. I'm like, if I'm going to exercise, then I want it to check all these boxes. And the third type is dual task exercise. It's where we engage the brain at the same time as the body. So walking and talking is the simplest example of this. But anything where you're cued. So if you're taking a ballroom dance class, many people have this association between brain protective benefits and ballroom dancing. What's happening is that you're engaging your brain in a bunch of different ways. Music, your spatial awareness, there's social awareness of where your partner is. You've got to remember the steps that you're physically engaged because you're active and moving. And so there's a lot of different things going on, and your brain is being stimulated in a bunch of different ways. But going to a yoga or Pilates or Zumba class where there's an instructor cueing you is also a great way to do it. For those of you who are particularly physically fit and intellectual, you go for a run and listen to a podcast that you find stimulating. The trick here is to pause it and then think about, what did I just learn? Because if you're passively just listening, then it's easy to kind of check out. Or if you go to one of those classes and you like been to the same yoga class for decades and you know what the instructor is going to say before they say it, and you're going through your grocery list while you're in yoga, that's not the same. What you want is that need to stay totally cognitively engaged. And what we see in the literature is that when you do that, you have much greater brain benefits than if you're just engaging, like say you're just doing Sudoku or Lumosity or whatever, you're just engaging the brain and then you're just engaging physically. So when you do both together, you get more benefit. We talked about pickleball. Pickleball is great because there's strategy, there's hand-eye coordination, there's social engagement. Many times you're outside, which is nice if the weather's good. And there's learning, if it's new to you, right? There's learning a new sport. So we highly encourage that if there's something fun. The other thing that's so important with activities and exercise is making it fun. So finding what motivates you, if showing up for a friend helps you to show up for it and makes it more fun for you. If a game makes it more fun for you, whatever makes it fun means that you're not going to do it for just a week, but you're going to do it for a lifetime, and it can become part of your identity.
Yes, I think what you said about taking that pause and asking yourself, can I sort of summarize or repeat what was just said in that podcast or said in that show? That's so important. I feel like it might have been at the beginning of the book. You mentioned a client who used to have the news on, like kind of 24/7 in the background. And then she had definitely made some other changes out of the toolkit that you mentioned. But one of them was, not just having the TV going on all the time in the background, but switching to, okay, I'm going to be intentional and watch one movie or something like that. Does that play into what you're talking about being a little bit more focused and intentional rather than having something just on in the background for comfort per se?
It's so interesting you bring that up because I'm a mom. You're a mom, right? There's this element as we age, especially when we are juggling many things, that is like, what is neurodegeneration? What is memory change? And what is just distractibility and overwhelm? And becoming mindful, taking the time to meditate. Meditation is a great tool, or prayer practice, a journaling practice, any mindfulness practice can allow us to kind of get out of that. Because how many times have you set your phone down or your bag down and then you can't, because you were so distracted because somebody was yelling or somebody was talking or you were doing multiple things at once, you forgot where you put it. And you wouldn't normally, but because we live in such a highly intense, like overstimulated society, it's really easy for that to happen. And so we have to actively find ways to not do that, right? To get out of that mode, and it requires effort. But I think it's a really great place for people to double click if they're concerned about cognitive decline. Like, is this actual cognitive decline or just overwhelm and distractibility?
Yeah, absolutely. So let's go into sleep because I feel like this can sometimes be overlooked. Or when we were preparing for this conversation, something we talked about is sometimes it is actually tested and still overlooked or maybe misdiagnosed as, no, you're fine, you don't have sleep apnea. And then you've seen people in your clinic where actually, no, you do have sleep apnea and there is something we can do to help you. So can you talk a little bit to why people might be getting misdiagnosed? Why is this getting missed? And what can people do? How can they go about testing?
Yeah, and I probably should have said, is this overwhelm, distractibility, or sleep deprivation, right? Because I think most of us can relate to being jet lagged or having an infant or having a reason why you miss sleep. Your sleep was interrupted. Going through menopause can really affect sleep and the quality of sleep as well. And feeling like your brain doesn't work in the morning, right? It's like, I'm not the same person I was. I don't get it. And it's because your sleep is, you're either not getting the quality of sleep or the amount of sleep. And what we see when I first started treating patients with dementia, I would ask, do you snore? Are you waking up tired? I would basically ask for the clues that somebody had sleep apnea. And I would only order a sleep study if they said yes to some of those things. And now, anyone with cognitive impairment, I am ordering a sleep study because, as you alluded to, I've had patients, many patients in my clinic, too many, who are thin, older women who don't know that they snore. And maybe it's because their partner takes his hearing aids out at night or their sleep partner has passed away. They don't have one anymore. So there wasn't an indication that this was needed. And as you sort of mentioned, I had women going in to get their sleep study. So I had ordered it. They had cognitive decline. They would show up and they would literally have people tell them, this happened more than once, you don't have sleep apnea. I can tell by just by who you are and your size and because you're not overweight. And then a couple days later, I would get the report back that said severe obstructive sleep apnea. And unfortunately, I think that this often goes undetected. It goes untreated, of course, if it's not being detected. And it's so accessible because Medicare covers this, insurance covers this. Sometimes you have to advocate for yourself. You have to be proactive and say, hey, I have cognitive impairment, or I feel like I'm getting cognitively impaired and I'm tired in the morning and I can't figure out why. And I'd like to have my sleep evaluated. Sometimes you have to push for that. But now the technology has improved so much that you can do an at-home one where you wear a watch and a ring. It's not the gold standard in sleep studies, but it is much more accessible and much less of a chore than going for an overnight sleep study in a clinic. And that way we can rule in sleep apnea. We can't always rule it out, but at least we can catch more of it in a simpler, cheaper, easier way, and then get it evaluated and addressed. Because even mild sleep apnea can have a big impact on cognitive function. If it's mild sleep apnea, you can actually treat it with mouth tape. So just taping your mouth shut at night and really encouraging your body to breathe through your nose. Another great book is Breath by James Nestor. And I have just learned over and over again, quality sleep, enough sleep, so minimum of 7 hours, hopefully 90 minutes of REM sleep and at least 60 minutes of deep sleep. This is going to be kind of the minimum for optimal brain function.
I hope that motivated everyone to give your sleep a second thought, and like you said, advocate if you need that testing. Don't just let somebody say, "Yep, no, you're fine." Actually, maybe go through the testing because it, like you said, it might uncover something that could really end up helping your brain health down the road. So let's dive into stress. I think we all know that we want to shield stress from us to support our brain health. Can you get into a little bit of the why it is so important to shield ourselves from stress? And if you have any great tips that you've seen be really successful in your clinics for folks that are looking to keep stress at bay?
Yeah, I think that stress gets a little bit of a bad rap. We want balance around stress, just like nutrients, right? We don't want too much sugar. We want lots of good, healthy nutrients. We want the right balance of things, not too much, not too little. And with stress, it's exactly the same. So, one of the, I think, most alarming indications of how bad stress is for you is that people in the Alzheimer's community, caregivers, those caring for someone with dementia, are anywhere from 2.5 to 6 times more likely to be diagnosed with Alzheimer's later in life than someone who's never served as a caregiver. And that's because of the burden of caregiving. It's the stress. They don't exercise as much. They don't eat as well. They don't sleep as well and then they're also going through the emotional toll of the long goodbye of saying goodbye to one of their loved ones and the changes and the grief each day. And that stress has a profound impact. Now, the flip side of that coin is too little stress. It's the lack of purpose and meaning that often comes after retirement. So, or even after the death of a spouse or a loved one, many caregivers will have that stress as well after their care partner passes away. So it's how do we cultivate as we age? How do we cultivate purpose and meaning? What does that look like? Again, we talked about Becca Levy's work and this idea that life, like the best is yet to come, that there's more good stuff to imagine and look forward to. And so staying engaged, so having, stress, cortisol is what gets us up out of bed in the morning. It's what helps us to show up. And so we need enough stress that we show up, but not so much that we decompensate. This is that idea of the hormetic effect, that we're stressing the system so that we have a more resilient, healthier system. And stress, I think most of us experience too much. And so, what are the ways that as humans we deal with this? It's really our relationship to it that's most important. We're not going to get away from the stressors of modern life. However, there are so many great tools, and in particular, Kirtan Kriya, a type of meditation, it's the Satanama meditation. That one has an abundant amount of research showing that it addresses insulin resistance, inflammation, diet and obesity. It changes our cravings, helps with hypertension. It helps at the causal level for many of the factors associated with dementia. And then it also improves cognition and our resilience to stress. And so there's a bunch of literature around Kirtan Kriya in particular. It's only 12 minutes a day, totally free. It's a great resource. However, it's not for everyone. There's other types of meditation, there's prayer, there's journaling, there's lots of different meditation practices. And whatever, or mindfulness practices, whatever, again, it's like whatever brings you joy, whatever you're going to enjoy, that is what you're going to be able to sustain and go back to. And so creating a practice is really about what you can routinize. What can you put into your day? I highly recommend doing this either at the beginning of your day in the morning or at the end of your day. Regardless of how proud of them we are, we all have morning and evening routines, and adding a meditation or a mindfulness practice at those bookends, I think of them like bookends of the day, adding them to what we're already doing routinely helps us make it a habit and a routine a little bit easier.
I think that's so important what you said about picking what you enjoy, sort of going back to that buffet of options. There's so many different forms of meditation. There's so many apps out there that you can kind of pick and choose what works for you, and it will be okay. And the same goes for exercise. And so and I think you mentioned something in the book about even the snacks that you have. If you like crackers, you don't necessarily have to say goodbye to crackers forever, but can you find a healthier version of that? So I like that this is really adaptable to everyone. It seems like you're setting up anyone who wants to go through this approach, setting them up for success, and kind of finding the joy in going through the process of it.
And hopefully getting the benefit right away. We'd love to see you feel successful so that you feel more engaged in life, so that you are having more fun. Like, what is life about if we're not here to have a good time and connect with others? And so, yeah, it's not meant to be a chore, even though it can feel like that at first.
Okay, so you mentioned caregivers and you mentioned connection. So in the book, you mentioned prioritizing connection over correction, and you talk about this concept of yes and then you have a few other suggestions as well. Could you get into that a little bit further for our caregivers out there?
Absolutely. I mentioned the risk of caregiver burden and how it increases the risk of developing dementia later in life, becoming the patient. And so I highly recommend that caregivers make themselves a priority out of the gate. Whenever I'm talking to a caregiver, I recommend that they take 8 hours per week, continuous 8 hours. So not a day, not an hour and 10 minutes each day, but 8 hours on Friday, and have that for yourself. Don't take care of grandkids or take care of somebody else. Take care of you. Engage in the things that bring you joy and have that time off. And there's several reasons why I recommend this. One, it makes you a better caregiver. So if you're burnt out, you're not as good at caring for your loved one. Many of us realize this, right? We're less patient, we're less creative. And having that time for yourself to get exercise, to maybe go grocery shopping or get the things that you enjoy at lunch with somebody who doesn't talk about dementia, those kinds of things are crucially important to the quality of care that you provide, but also to your own health and reducing the burden. Additionally, fast forward, something might come up for you and you won't be available to your care partner, to the person you're caring for. We've seen this happen over and over again for countless reasons. The caregiver ends up in the hospital. They're not available to take care of their loved one with dementia. And now they just need a warm body to babysit. And that is not the ideal person taking care of their loved one. So forcing yourself to find other people who can be on that care team, it's not a one-person job, is really, really important. And I encourage it well before you think you need it. Now, when it comes to that quality of care, connection over correction, and you'll hear this phrase applied to parenting, any sort of relationship, right? We feel more connected when we're not being corrected. So how do we, and when we feel connected, that amplifies the joy, right? The enjoyment we get from the relationship is so much higher when we feel that closeness, that bond, that we're connected in some way, whether it's physically or emotionally or intellectually. There's lots of different ways to connect. But one of the quickest things to make us feel disconnected is if we feel a power dynamic or if we feel like we're being told we're doing something wrong. And people with dementia, they don't lose the emotion, right? The emotion is there. So the tone of voice, the way, the quality of engagement, the quality of communication is less, becomes, especially as the disease progresses, is less about the words that we're saying and more about how we're delivering it. And so, yeah, there are the phrases of yes and. So if somebody says, I had breakfast with mom this morning and mom's been passed away 25 years ago, then saying, oh, what'd you have? Rather than reminding her that her mom is dead, right? You're going to get more connection. And that is going to increase the quality of the relationship and also allow, instead of escalating that a heightened sense of emotionality or anxiety or feeling like they're wrong, there's a diffusion, right? There's a relaxing. And that is where healing happens. It doesn't happen when you feel like you're having to defend yourself.
That makes absolute sense. So thank you for that. So we've gone through some of these tips in the toolkit. Why is consistency so critical for when you've kind of latched on to this is the 1, 2, 3 different changes that I'm going to incorporate into my life? Why is it important to really stick to that routine? And do you have any favorite tips for morning or evening routines that you've seen work particularly well?
Yeah, so consistency, again, it's about the rules, not the exception. So it's about the routine. It's what we do each day that really determines how healthy we are as we age. And so if we don't, you don't build biceps over one day in the gym. You build them over months. And so it's about that is really what creates that trajectory as we age. And so making things a routine. Of course, we want to go on our trip to Italy and enjoy, indulge in wine and cheese and pasta. But then when we come back, it's really important to get back into that healthy routine. So it's okay to go to a wedding and indulge. It's not about not living life, but it's saying, what is the routine day to day, most of the time, that's going to serve my health best? And so that's basically what we want to set up. And you don't have to do all of it yesterday, right? It's like we can layer these things on top of each other. What we want is to celebrate the successes and then have more and more and more wins. And so I'm sorry, where did we want to go with that?
No, and then we had just talked about like morning or evening
Oh,
routine. Do you
routines.
have any just special routines that you've heard that work particularly well first thing in the morning or before going to bed?
Yeah, well, I'll just share personally. I find, and going through the book launch, so coming into June, the first 6 months of this year were very, very stressful for me personally, and I let go of my morning routine sometimes, and I think that contributed to the stress because I felt like I had to put all these other things first, and it's only through the book launch, and then it's this idea that like it'll be better later. I'm human too. I go through the same things. And when I get up in the morning, I get up at 6. When I get up and I have my matcha tea, which is good for my brain, and I put some collagen powder or some keto creamer in there, some organic unsweetened almond milk. I have my tea in the morning and then I meditate for 30 minutes. And then I drop my daughter off at school and I go to Pilates. And when don't start my day, I don't like my emails until after that, I am a different person. Again, I am more patient, more creative. I'm a better version of myself. And when I start skipping that and I make other things more important, I fall apart. And so I speak from personal experience when I share how important these things are. Like I, I encourage everyone to just experiment with it because it's really your personal experience that is going to help you and motivate you to continue things like this, right? If I'm just sitting here wagging my finger saying, you should do this and you should do that, or if you're shoulding all over yourself, right? Because I do that to myself too. I should have meditated this morning. I should have exercised yesterday. And that, again, it's like you're defending yourself, you're correcting yourself. And instead of having some compassion and just saying, all right, tomorrow's a new day, let's get started. You know, you have the data, you feel better when you do this or that, then I think it's easier to get in the rhythm and get in the routine. And having accountability buddies too, having a friend or a partner, somebody who can encourage you and also remind you to prioritize your own health.
Yeah, it's almost like getting to know yourself better. You know, what we do today for our morning routine, it might look different 5 years from now, and just being open and flexible to that as long as we're sticking to something that's positive for us.
Absolutely.
Okay, so we've gone through all of these pieces of the toolkit, and they seem, like you said, somewhat common sense. The science behind them is all very intriguing and it does make sense. And that is constantly changing, like you said. But so why are more physicians not talking about this, or maybe prescribing this to their patients if it is so effective?
Yeah, unfortunately, the system of medicine, again, I think many people can relate. You can't share this information in 7 minutes or 15 minutes if you're lucky with a provider. And the tool belt, and this is part of why we call it a new toolkit, the toolkit in a conventional neurology office or primary care office is usually drugs or surgery, maybe workup, imaging, labs. But for resolution of disease, for a comprehensive conversation about all of the risk factors, that doesn't happen in a quick visit because that requires a back and forth about what are you eating? What grocery stores do you go to? What time do you eat? Who's doing the cooking? What about exercise? Are there any constraints? Do you have chronic pain that prevents you from doing these things? How's your sleep? All of those conversations could each take 10 or 15 minutes themselves, right? And we don't have that. Our medical system isn't set up to spend that time getting to know someone. And so we lack this ability to intervene within that system. And so I'm a naturopathic doctor. I practice outside of the conventional system because I don't have the constraints of that. And also, there's another component, the research. We've been in this paradigm of a single molecule intervention is going to solve our problems, our diseases. And if you've got strep throat or urinary tract infection, you're in the right place. It will help. If you get in a car accident or you've broken your leg, go immediately to the emergency room. There's great acute care in this country. But when it comes to complex chronic disease, again, it's a paradigm shift away from that single molecule, simple intervention for that particular diagnosis to a much more complex system science approach where we have a complex issue, multiple causes, multiple factors impacting brain health, and we need a complex precision-based intervention. And I don't see that happening in the conventional current medical system. It needs to change. It needs to shift.
And in the meantime, speaking with physicians like yourself and spreading the word on how this really can work. So I'm excited for your book and for people to read more in depth on what they can do, what they have the power to do to support their brain health. So we do have some questions coming in. So I want to shift over to some Q&A. And we didn't get to this. So this is a great question about the Montreal Cognitive Assessment, which you discuss in the book. Someone is asking if you can explain a little bit more about that. Would they go to an internist for that? Is it something that they can take in a different way?
Yeah, so there's a handful of different cognitive assessments, and the MoCA, the Montreal Cognitive Assessment, is one of them. So you might have heard of the Mini Mental Status Exam, the SLUMS test, or the MoCA, the Montreal Cognitive Assessment. And these are one-page worksheets that just take a few minutes. A medical assistant doesn't have to be a doctor administering them, but a trained professional can administer these in 15 to 30 minutes. And you get a number associated with your cognitive function, and it's out of 30. And so a perfect score is 30, 26 and above is normal. And then as you get closer to 0, that indicates progression of the disease process. And so you'd imagine like a MoCA score of 0 is somebody who's no longer verbal, who can't answer questions at all. And these are blunt instruments. They are not highly refined tools, but they tend to work and they help providers communicate between each other. It gives us, you're somewhere on this spectrum, on this 30-point spectrum, and it helps us understand. It's like a measuring stick. Are you getting better 6 months later with our intervention, or are you getting worse? Do we need to dig deeper? Do we need to understand more about what the causal level factors are? And so that's one way to give us an assessment of where things are. Now, there are other ways to do that too. So imaging is highly nuanced, but MRIs of the brain, there are quantitative, basically neuroquant testing or neuroreader testing, where they can look at volumetrics. How big are the different parts of your brain? How big are the ventricles? How big is the hippocampus, that memory center of the brain? How big is the parietal lobe? And then we can also look at perfusion. That's used mostly, so how much glucose is being taken up? How much blood flow is there in the brain? And that's an actually even earlier indicator than the quantitative volumetrics. Another way to look, which is pretty brand new and not covered by insurance yet, but is the p-tau number. So phosphorylated tau, or p-tau 217, is a marker that can indicate early structural changes in the brain, sometimes before there are even symptoms of cognitive decline happening. And this is not a diagnosis of Alzheimer's, but it's an early indicator that something is changing. Now, it'll also be there in the later stages, and it can give us a little bit of directionality. So it doesn't say, why is the brain changing? It doesn't answer that question of like the toxins and the nutrients and the structural issues and the stressors. It's not in that category, but it says downstream, how much is the brain being affected by dementia? And when we look at them longitudinally, 6 months later, and then 6 months later, and then 6 months after that, we can see, are we going again in the right direction or not? The reason I like the MoCA score, the Montreal Cognitive Assessment, it's the one that we do in my office, and so I have the most familiarity with it. But it's also about what matters most. Can I answer a question? Do I know what time it is? Do I know where I am? When we think about Alzheimer's, you don't really care what your p-tau number is. You care, can I function in my day-to-day life? And that's, I think sometimes we get lost in the, what's my beta amyloid? Doesn't matter if we can function. How much, that's where the rubber meets the road in this space, is what is my cognitive capacity?
Absolutely. Thank you for that. So we have this might be getting a little specific. I'm sure you'll answer in broad strokes, which is, what do you think about melatonin for insomnia? This individual has heard that it is not great for osteoporosis. So just curious if you can talk about that a little bit.
Yeah, so for the most part, brain health and bone health are highly aligned. And when we talk about things usually they come together, right? Getting good nutrients, minerals, vitamin D, K, exercise, that's weight-bearing exercise, often estrogen replacement, hormonal replacement can be part of that conversation for both brain health and bone health. Melatonin, there was recent research that came out that showed that melatonin can help to reduce the risk of dementia. And so if you're having trouble with sleep, there's lots of options, and many of them are terrible for cognitive function. So benzodiazepines can be really hard on cognitive function. Cannabis, very hard on cognitive function. There are many, if you just go to many over-the-counter sleep medications, are diphenhydramine, or an antihistamine, also used in Benadryl, that can help put you to sleep, but also has an anticholinergic effect, which can be hard on the brain as well. So many of the most common things that people reach for as sleep aids are hard, very hard on cognition, especially over time. So melatonin as an alternative to those, I think, is a fantastic idea, because it's also antioxidant, anti-cancer, and can help with that circadian rhythm. So if somebody, particularly as people progress down the dementia pathway, it can be harder and harder to stay with that circadian rhythm, and melatonin can help get us back there. I think using melatonin after jet lag, trying to get back on a sleep routine, it's a great use of melatonin. I typically start with doses that are low, so you'll often see 1, 5, 10, 20 milligrams in the store. I would recommend starting with a 0.5 milligram, which is closer to the physiologic dose. So what your brain will produce is about 300 micrograms. So when you start getting to 3 grams, you're 10 times over that. And although we don't see a lot of dependence, it can make some people groggy in the morning. And so that's not good for cognition.
Okay, thank you. That's just a wealth of knowledge there. So we are winding down. I want to be conscious of the times. We have about 5 minutes left. Someone has heard about the p-tau blood marker, PTAU, and they're just curious when this might be available or if you have any insights on it.
Yeah. So p-tau, there's two different p-taus, p-tau 181, which is not that helpful. So that can go up and down. And then there's amyloid ratios that also can go up and down, say if you get COVID. These also can change if you lose a lot of weight. So if you're starting a new exercise or diet routine, that can also change them. Now, these are available through LabCorp and Quest now. You just have to pay for them out of pocket. And they can run, if you do all of them, it'll probably be around $1,000. But p-tau 217, which I think is the best marker at this stage, that I think is like $400, depending on where you're going and kind of who you're asking. But those are hard to pin down sometimes, the cost on these things. And it's changing as well. They've only been available, I think, since March. So in the last 6 months, outside of the research world, they are available to the public now. So you can ask your provider for them as long as you're willing to pay out of pocket. And the one I recommend is p-tau 217, not the 181.
Got it. Thank you. Okay, so I think we have time for one last question. I think you did answer this somewhat. They're asking how long would you stay in the organic ketogenic diet, which I believe you said not longer than 6 months. And they're asking what would you cycle with it?
Yeah, great question. So, okay, there's a bunch of different categories. So, somebody who has cognitive impairment already, I recommend 3 to 6 months minimum to get you started. And then, if you have cognitive impairment and you struggle with that, you want to go back into ketosis and basically be in ketosis most of the time. So, at Marama, what we'll do is 5 out of 7 days. So, Monday through Friday, people are in ketosis, and then they fall out of ketosis. We add back seasonal fruit and starchy veggies like squash, carrots, beets, high polyphenol rich, all the good stuff that you've been missing. We add that back, but we don't go to cake and cookies on the weekend, right? We don't overindulge. We add back things that are really highly nutrient dense. And one thing that I recommend at home is because there's data on both plant-based and keto diets, what you might want to do is go back and forth between a plant-based diet and a keto diet. Or maybe the keto diet and the mind diet. Now, the mind diet has processed food. You'll see bread and carbs and more processed food in it. But maybe depending on where you're traveling to, maybe you adopt more of a mind diet. It also restricts salt, which I think minerals are really important for cognitive function. So we don't want to do a lot of processed foods that are in cans that have a bunch of sodium. But having plenty of sea salt in your diet is not a bad idea. And then I don't have dementia risk, thank goodness, genetically, but I get into ketosis 4 times a year for 3 weeks or so. I'm in ketosis right now. And I do that to maintain my metabolic flexibility because I think it's important to reducing my risk of all diseases associated with aging. And so that's how I approach it. And I would recommend that for most people. You want the metabolic flexibility of going back and forth between burning fat for fuel and burning sugar for fuel.
Thank you so much, Dr. Sandison, for being with us this evening. I feel like we might have a part 2 coming up down the road, maybe a few months from now, because there's just so much to dive into. But you really, I think, gave the audience a wonderful overview. We dove deep into some of the topics. And of course, picking up the book, there's a lot more there that goes into each of these 8 pieces of the toolkit. So I want to thank you so much for being with us this evening. To our audience out there, yes, this was recorded. We will be sending the copy of the event tonight out to you and for anyone who missed it. Friendly reminder that we do have Dr. Solomon with us on the virtual Spark Your Health stage next Monday at 7 p.m. Eastern time as well. So we hope you will join us for that. And I hope that everyone is thinking about what their evening routine will be and their morning routine will be that is going to support their cognitive health as we move forward. So thank you so much again and stay well, everyone.